So the automated insulin delivery system that I use has helped me to reduce my HbA1c from 6.8, 6.9 before I implemented it. And my last HbA1c was 6.0. So this automated insulin delivery system itself has made life significantly more manageable for me, not just the diabetes, but life overall, much more manageable.
Automated insulin delivery, I think they're amazing. I can say I have a lot of less worries, fears, and I would say psychologically free mind about life with diabetes. I can really say that I really sometimes can forget that I have diabetes with this kind of insulin delivery.
I struggle to actually talk about how much it has completely changed my diabetes management and my life actually in general. The first thing was sleep. I know everybody says that, but the sleep quality that I had just changed dramatically to the point where my daughter wanted to know why I was so chirpy first thing in the morning. But we have a really active Australian looping community and a great Facebook page called Aussie Loop. And it's a constant support for people with diabetes who have gone down this path.
What I learned in Germany in all these years when diabetes technology is improving, that on the same hand, the education has to follow these steps and not being left behind. The best automated insulin delivery system is only working well when the user gets the proper education.
In Belgium, the government is funding a special diabetes system for all people with diabetes, and there are no age restrictions. So you have access to new technologies without any extra out-of-pocket costs. I believe there are large inequalities between the European countries, and I think it really hurts when you are using an insulin pump from previous generation and you see your friends from a different country have access to the newest models.
In Germany, the healthcare system is pretty good. I think the whole world kind of knows that. But it's still not that easy. Like the insurance would cover a pump or a CGM, but you have to apply for it. And most of the time they say first, no, you don't get it paid. Then you have to send in all your blood sugars from the past 3 months. And if your blood sugar or like your A1C is too good, they actually say, no, you don't get a pump or a CGM because it's already working well. So we won't spend any money on you.
We're a population of 1.9 million people, which is tiny, I know. But even within my peer group of folk living with type 1, what we can access and where we can access it varies widely. The biggest obstacle for people living in Northern Ireland to accessing the technology is actually knowing that it exists and that it's out there. And it still astounds me that 6 years after I started using a Freestyle Libre, that people I come into contact with who've lived with type 1 diabetes for 15, 20 years have never heard of it because it hasn't been actively promoted by their healthcare professionals because they haven't seen a need to share the information or because of time pressures with being able to share it.
We have what's called our pharmaceutical benefits scheme, and that takes care of how we are able to access insulin. I know every single time I go to the pharmacy to pick up a prescription of insulin that I will get 5 10ml vials for around 41, 42 Australian dollars. Technology is a little bit more convoluted, so you do need to have private health insurance if you want to access a fully subsidised pump. And then the consumables are are supplied through the National Diabetes Services Scheme, which is a government initiative that's administered by Diabetes Australia. They're heavily subsidised. So you're looking at about $30 a month for pump consumables. That's your out-of-pocket cost. And continuous glucose monitoring and flash glucose monitoring is also subsidised through the NDSS. It's fully subsidised if you're under 21 or on a low income healthcare card, or if you're planning for or if you are pregnant. So there's great access. There's still room to move though. And I work for a diabetes organisation. We're constantly lobbying and advocating to improve access for all people with diabetes.
Nowadays in Croatia, from the 1st of March, we have in opinion to get automated insulin delivery pump, and we need to pay some extra money, of course, on it, but we are really satisfied that we got this. Usually Croatia is a small country, and we are sometimes getting some things on diabetes technology very late when they're like all over the world already. But it would be great if type 2 people with type 2 diabetes can get just a little bit of this technology, especially for the ones who really need and who really wants to work on their health.
I think the biggest challenges for people with diabetes in Germany are actually the stereotypes, because a lot of people know a lot about diabetes, or at least they think they know, but actually it's all very discriminating. Stigma and discrimination, of course. And it's we just got 2 days ago, we got the complaint from one girl that she accidentally gave herself 40 units of insulin in a day, and she was on work. She didn't have a glucagon with herself, and the emergency didn't want to help her. So it was why not? And this is the part of when they don't understand that sometimes we are really calling them because we can sense that something is wrong.
So stigma is an issue everywhere. And we see that, every time I have a discussion with people, it doesn't matter where they are, they talk about stigma being an issue for them and being a problem, and being a barrier to care and access and to research. So there might be some slight changes and differences that you might hear, but this whole idea of diabetes and what the general public think about diabetes, often how health professionals respond to people with diabetes, how the media talks about diabetes, all of this has contributed to this image problem that we have.
One of the topics that I have been involved in is green diabetes, is diabetes waste. And people with diabetes in Europe are very aware of the problem of waste, and they also want to find a solution. They want to be more eco-friendly with their diabetes. So I think we can also do something together in this area, because it's a very important and very common problem.
In terms of Ukraine and being able to help people, we have had a massive response from our local community. We've had people who've donated pens, pumps, sensors, Libres, pump consumables, and we've been able to pass that on to medics who were going out to Ukraine through a local charity that was set up by medics from here.
The war in Ukraine, for me, it's really devastating, especially because I'm Polish, and I know about all the efforts that are happening right now in Poland to help Ukrainian people. And it has to be really a nightmare for people living with diabetes who are Ukrainian. And I know there are many ways that the community can help. And I want to say that it's really important that we use already established networks. So we really help rather than we waste supplies. I myself conducted a collection point in Belgium, but it was an organized effort with Polish Diabetes Association.
We have a lot of refugees from the Ukraine coming to Germany. And I mean, we do the best we can. And especially thinking about people with type 1 or disabilities, chronic conditions that are right now not able to manage their conditions because they had to flee their country. It's really, it's sad and upsetting.
Actually, we are trying to help the people in the Ukraine in two different ways. On the one hand, we are sending parcels just like we pack. We are in contact with a clinic directly in Kiev, so they are sending us what they want. So we are not only packing diabetes equipment, for sure we're sending them pens and insulin, but we are also sending them medication they need for operation and stuff like this. And we as the DIY community are helping type 1 diabetics who arrive in Berlin. The biggest problem for the supplies is the uncertainty if they reach their destination. And we were so fortunate that we had direct contact with the driver who was transporting our stuff. And so when he finally reached Kiev after, I think, 2 days with not too many stops in Kiev, they sent us a video in Ukraine. So we unfortunately did not understand the words, but we saw our parcels and boxes, and so the people were waving to us and looked quite happy.
We sent the email to the Ukrainian embassy and saying them, like, if you have anyone who is living with type 1 or type 2 diabetes and they need anything from this side, like, just feel free and call us. And when we sent the email, we got, like, I think it was 10 calls in the next 3 days about helping someone. And there was one policeman who said that he needs he heard that someone needs diabetes supplies, and we got only 3 hours to collect something, and we just put it on the social medias that we will collecting this in next 3 hours. And we make the full car of everything. And when he came here, he was like looking and said, "Oh my God, this is too much. I don't know if I will have if I will have enough space to take all of this." As we were in a war, like, okay, it was a little bit before my time, but everybody are talking about that. We as a nation really can understand these things, and we are like, we have empathy to them. So even now, if anyone in Croatia knows someone who is from Ukraine, we are like, just come here, come in our association, like, we will give you everything what we can, or make you some suggestions what you can do as your next steps.
So I've been involved in the Spare a Rose Save a Child, and this year we changed that to Spare a Rose Save a Life campaign, which runs in February every year. It's a community initiative. It was started by some diabetes advocates in the US, and it's become a truly global campaign by the community for the community. We realised that there were people in the community crying out for how to support people with diabetes affected by the war in Ukraine. So we've extended Spare a Rose for Ukraine. It's been hugely supported by the diabetes community globally. We've raised to date about $140,000 in community donations, plus about another $90,000 in corporate partnerships, which is just truly remarkable. This is people with diabetes very, very conscious about making sure that people who are affected by the war are still able to access their insulin and their other diabetes supplies. So, you know, I never ever am startled by just how much this community wants to give back. It's something actually really very, very special, I think.
Despite the differences, I believe we need to stay connected because we are all in the same boat. We all have diabetes, and we can do great things by working together, collaborating together. Every experience is valuable.
Having a system in place that levels the playing field for everybody living with any type of diabetes for any period of time, and making it accessible for everyone, regardless of their social, financial, or educational circumstances, is the one thing that we can do to help to improve the quality of life of people living with diabetes globally.